The PSA Excellence Awards acknowledge the achievers of the pharmacy profession. In particular, those involved in innovative practice, those striving to raise practice standards, and those who, through their professionalism, provide a model of practice for others to emulate. Meet the recipients of the 2012 PSA Excellence Awards.
I'm such a traveller through pharmacy as a career. It's like I have got 5 jobs. I love every single one of them. The hard part for me is to try and explain that to other people, that every single one of those roles is crucially important.
Well, I think I'd probably be remembered for my involvement in AmFac Chem Data, because it did eventually reach 84% of Australia's community pharmacies.
I'm in what is my dream job, in that I teach and I practice. So I'm on the wards 2 days a week being a clinical pharmacist, and I'm an on-site educator here at the Royal Brisbane for the other 2 days a week, and then teaching even at a student level.
The hospital pharmacist is absolutely important for a patient in an acute care episode. But no less important is their community pharmacist, who's responsible for their ongoing and everyday care. You know, that's probably the area that I love doing. It's linking people and linking patients with appropriate pharmacists.
When we developed the individual record cards for each person, we then had every drug or prescription that the patient had taken. So we were able to then counsel the patient on their previous history. That was not possible with prescription books. We now had the drugs history, but they were all in different places. They were in this book, the monograph was here, the interactions for that drug was somewhere else. So we needed to prepare an individual drug record card. So that's what we did. We developed an individual card for the most popular 800 drugs dispensed on the PBS. We leave the pharmacy at 6 p.m. My wife had gone home at 5:30 and got dinner. We would eat by 6:30. I'd be working by 7, and I finished about 2 or 3 in the morning. I went running at 7 a.m. in the morning with my dogs, and we're back at the pharmacy at 9 a.m. 6 days a week that happened. And Sunday I had a very early night.
About 4 years ago, I heard of a need for some textbooks at the University of Port Moresby, and I got in touch with some staff in New Guinea, and they straight away said that we'd love to have some staff. So I admitted that I had limited teaching experience and limited clinical pharmacy experience, but that I'd be happy to come over and do what I can do and see if I can help out within the department. And have been doing that yearly ever since.
Mentoring young pharmacists, I think, is a really important role. It's probably an acknowledgement that I'm getting older, but I think we really do have a role in shaping the direction of pharmacy.
I've been able to do a lot of volunteering, both locally and with my work overseas, and I certainly think it's a great avenue for pharmacists as health professionals.
It's an exciting time. There's, more people going into hospital sicker and getting discharged still unwell. We have to provide the sort of environment where our young pharmacists feel capable of not just doing one role, but actually being able to transition across several.
Pharmacists have such a unique set of skills and knowledge that no one else has, and I guess especially with my work in these developing countries, I've been able to see firsthand how helpful we can be. And I certainly don't think I'm anything special, but my skills and knowledge as a pharmacist from Australia can be so valuable in countries like Papua New Guinea and Sri Lanka.
The Colloq card money bought the first computer system, and they had 8-inch floppy disks. One floppy disk was the program and all the databases. The other was the pharmacy's own private data. So every month I produced in the pharmacy, as part of my duties, a new disk to send to all of those pharmacies. Then they'd operate on those new regulations for the month. Any new interactions, all the drug notes that became the forerunner for CMI, and all the drug master file of new drugs and changes of pack sizes, changes of price.
Nothing beats being out there talking to patients and really like being their medicine's interpreter, being able to untangle a problem and help them sort their way through something difficult. It's really rewarding.
There's lots of things that I like about my job. I really love working with patients and other health professionals to have better health outcomes. The patient interaction, I think, is a really special part of being a pharmacist. But I guess the thing that I absolutely love about my job is the variety that it gives me.
I guess if there's anything that I hope that people can take out from what I do is that you don't have to be defined by a building or a role, that you can spread yourself across a certain number of roles, and it can only add to how you are as a pharmacist.
We did what we believed in. We believed that pharmacy had a future that was way beyond supply, that clinical decision support could be conducted by the computer to give prompts to the practitioner to assist the patient to get a better result from their medicine regimen. Now that's where I saw health heading.
It is challenging. We've got an explosion of drugs and technologies, and then you have that against a backdrop of cost containment in the hospital system. So you really do have to be a profession that's adaptable.
I would really like to think that what I exposed was the idea that individual patients require individual counselling based on their history and the particular drug properties. I like to think that we married those together, and along the way we provided the tools and the resources so that pharmacists could do that, that they were involved with the patient rather than literally supplying a drug with great skill but with no personal contact. I would like to think we put relationship into pharmacy, more relationship.
I recently read somewhere that 60% of the 27,000 pharmacists in Australia are below the age of 40, and 20% of them are between the ages of 26 to 30, which I think is a really positive thing for our profession. I mean, we have so much to learn from pharmacists with a lot of experience, but we're now in a climate, I guess, where there's so many young, hopefully enthusiastic pharmacists out there to push those boundaries and start to find roles for pharmacists that haven't previously existed.
I think we're an answer. I think we're one of the solutions to the complexity of life, and that's why I think we need to take our skills to the streets and to our colleagues and really start to get our message across that we are the quality use of medicines managers, and every patient deserves a pharmacist to accompany them on their medication management journey.